Hello, everyone. Thanks for joining. We're just going to give it a moment for everyone to connect to their audio. Hello, everyone, and welcome to our ISPCAN webinar. My name is Jane Estes, and I'm the ISPCAN Knowledge and Content Development Manager and your moderator for today's session. Also joining us online are Holly Malcolm, our ISPCAN Membership and Marketing Manager, and Pragati Tamala, our ISPCAN CEO and Executive Director. ISPCAN's international webinars are always free of charge and cover diverse topics which are presented by subject matter experts from around the globe. These 90-minute webinars are designed to help our members and partners gain access to knowledge and expertise to inform care, improve practice, and drive policy change. All this is critical to help improve the outcomes for children globally. And because we believe that you should have access to all of the information and resources available to support you in your work, we encourage you to visit our ISPCAN Knowledge Hub. The ISPCAN Knowledge Hub is an open access centralized library containing ISPCAN and impactful partner resources. This user-friendly hub features ISPCAN webinars, journal clubs, masterclasses, monthly article insights, data-driven global reports, and shared partner and downloadable resources. If you have an open access resource that you would like shared, please email me at partnerships@ispcan.org. We are so thrilled that you're with us today, and we wanted to share some tips for making the most of today's session. Just please engage with us. This session is meant to be an active, interactive learning platform. Please participate by sharing your comments in the chat and your questions in the Q&A box throughout the webinar. We will use your questions to begin the Q&A session immediately at the conclusion of the presentations. To enhance your experience, you may enable closed captioning from your Zoom control bar by choosing Captions. And please now take a moment, introduce yourself to other attendees, our ISPCAN team, and our featured presenters in the chat box. Let us know where you're joining from and your organization and your discipline. And for joining us today, a recording of this session, the panel discussion, presentation slides, and links to all featured resources shared by our presenters will be sent to you after the webinar. We are excited to announce today's topic, Driving Change in Far East Asia's Child Protective Systems through Impactful Collaborative Efforts. This 90-minute session will offer a unique opportunity to hear directly from the leaders of 6 pivotal organizations representing countries in Far East Asia. Our presenters will address challenges and share cutting-edge approaches to their child protective systems. We'd like to offer a special acknowledgement to Dr. Patrick Chung and the team at Against Child Abuse Hong Kong for bringing this important topic forward and co-hosting this session with us as part of their 45th anniversary celebration. Our key learning objectives for today's session are to understand the similarities and the differences in child protective systems by exploring multiple country-level approaches, to achieve a deeper understanding of the ways systems could be improved and multidisciplinary collaboration achieved from the perspective of country-level experts, and to understand the challenges, achievements, and ways forward in child protection work. And now to meet our panelists, representing 5 ISPCAN country partner organizations. Dr. Patrick Chung. Dr. Chung is a consultant pediatrician of Hong Kong Hospital Authority. He is an honorary clinical associate professor of the University of Hong Kong and the Chinese University of Hong Kong. He is the director of Child Protection Simulation Training Course of the Hong Kong College of Pediatricians. Dr. Chung is also the chairperson for Against Child Abuse, an NGO specializing in child protection since 1979. We're honored to have Patrick and Against Child Abuse as co-hosts for this webinar. Dr. Ayoko Ishikawa. Ayoko is a general pediatrician now working in Hodaka Central General Hospital in Japan. She's a member of the Japanese Society for Prevention of Child Abuse and Neglect and the Japanese Medical Society on Child Abuse and Neglect. She's prepared her hospital to be the medical center of the area's sexual assault response team and helps connect children to regional trauma therapists. She is also a central member of Japan's Child Death Review Model Project. Dr. Yogeswari Munasamy. Yogesh is a senior principal social worker at the Practice Innovation and Capability Development Unit, which is part of Child Protective Service and Ministry of Social and Family Development. Yogesh is an experienced clinician in child protection in Singapore and an experienced supervisor and trainer in the areas of trauma-informed practice, working with vulnerable families, protective behaviors, and care of the professional. Joining her from Singapore Children's Society is Gracia Go. Gracia is Senior Director overseeing the Children in Care Group and professional development in Singapore's Children's Society. As a social service practitioner, she works closely with children and young persons who have been abused and/or severely neglected in residential care. Gracia also works with multi-stress families through the Family Service Center. And Fran Gao. Fran currently serves as the Chief Operating Officer for the Child Trauma and Resilience Center at Child Welfare League Foundation, headquartered in Taipei. Launched in 2020, the center provides trauma-informed direct services through an integrated interdisciplinary service model to children who suffer from developmental trauma. Fran trains trauma-informed practice to social service providers, healthcare professionals, judicial officers, and the educational staff across the country. And now it's my honor to turn the session over to Dr. Patrick Chung.
Hello. Hello, everyone. I first like to share my screen first. Do everyone see the screen and hear my voice?
It's perfect. Thank you, Patrick.
Thank you. So, hello, everyone. I'm Dr. Patrick Chung. I'm a pediatrician and also chairperson of the Against Child Abuse. I'm pleased to co-host and present in this webinar. A little about how this webinar comes about. For many years, Against Child Abuse has been looking at how child protection systems can be improved. We got in touch with IPSCAN's Chief Executive, Brackethy, to discuss about it. We took reference from the publication World Perspective on Child Abuse. And, sorry. This is really an anchor to the understanding of systems and practices in different parts of the world. Very rich information. I was looking for information on mandatory reporting. For some months, Pragathy, June, Holly, and Fujiko Yamada, IPSCAN's board member, through our emails and later joined by partners from Japan, Singapore, Taiwan, we thought it would be wonderful to have a webinar to share our experiences in the Far East. And there you are. We came up with the theme of this webinar, Driving Change, Far East Asia Protective Systems, Impactful Collaborative Efforts. So I'd like to start with a short introduction of Hong Kong, China. We have a population of 7.3 million, 15% are children. Hong Kong has a total area of over 1,100 square kilometers. The GDP per capita is around 50,000 US, and life expectancy is 83 years for males and 87 for females. A short introduction on Against Child Abuse. This year is our 45th anniversary. ACA was first established in the International Year of the Child in 1979, with the community responding to the plight of a poor 10-year-old girl. We have developed over the years and is now providing a comprehensive range of child protection services from hotline, crisis intervention, casework, treatment, training, education of the professionals and the public, preventive and advocacy works. And you can find the milestones of child protection in Hong Kong in our website, which is at the bottom right-hand corner. And you are most welcome to visit. Now, pursuing a systemic change in child protection system is the title of my sharing. Now, a child protection system is a very broad topic. We could discuss its framework, purpose, the components, the involved parties, and their relationships. There are many components, the laws, policies, establishments, etc. To set the scene, I have listed here the incidence of child abuse in some countries from the world's perspective. As you can see, Hong Kong has 1.52 per 1,000, Japan 12, Singapore 5, and Taiwan 3. And probably the differences are due to the definition of abuse in different countries, and also the data collection. So the diagram on the right shows a higher number of abuse in poorer districts. Now, official data of abuse are kept in the Child Protection Registry of the Social Welfare Department. And this diagram shows a marked increase in child abuse cases in the past few years. And this is due to increased public awareness, COVID, law reforms, professional concern, etc., etc. And we understand before a case is entered into the registry, it has to be identified first, get reported, investigated, and then defined in the MTCC. So you can understand this number only reflects a small proportion of abuse in the community. And this diagram shows the number of different types of child abuse over the years. Physical and sexual abuse accounts for 75%, and there was an increase in child neglect from 2014, and I will explain later. Psychological abuse and multiple abuse numbers are very low. In my presentation, I will illustrate with examples in 4 areas: legislation, procedures, establishments, and services. The paragraph in small fonts is the abstract of this presentation. First, on legislation. There are many factors leading up to the mandatory reporting in Hong Kong, and I list below. Number 1, community concern, tragic incidents, court cases. Number 2, the law addressing specific abuse situations, for example, the failure to protect offense. Number 3, the UNCRC was extended to Hong Kong in 1994, and its concluding observations in 2013 recommended us to adopt a coordinating framework, including mandatory reporting. The concern on the very low reporting rate. And number 5, the procedure guides, there are bound to be hiccups in the handling procedures. Number 6, we take reference from IPSCAN's world perspective, in which 71 of the 86 countries surveyed has mandatory laws in place. Number 7, an institutional child abuse incident took place in 2021. And the recommendation from our ombudsman, advocacy by various parties, the social work, the NGO, health sectors, etc. All these leads to the pushing forward of mandatory reporting, which was announced by our chief executive in year 2022, the policy address. What followed were numerous consultations by the government, advocacy papers, extensive debates, forums, etc. And the Legislative Council and the authorities has been working hard on the bill. In fact, at this very moment, the bill is being read at the Legislative Council. We will await for the good news. So there will be a lead time of 18 months after the gazette of the legislation for the development of supporting measures before its full implementation. Now I move on to illustrate more legislation. Now, the law to criminalize child abuse and neglect is in the Offense Against the Persons Ordinance. However, Section 27 in this ordinance does not address psychological abuse well. Almost all prosecutions in this section involve physical assaults. The terms in the ordinance, namely willfully assault, ill-treat, neglect, etc., they all need clear definition. And similarly, the types of harm should be clearly defined, and mental derangement is an antiquated term. Now, the ordinance in Hong Kong is based on UK law, and in UK, the Children and Young Persons Act in 1933 was amended in 2015. The so-called Cinderella law is explicit in that the offense covers conduct which is likely to cause psychological suffering or injury, as well as physical harm. And ill treatments can either be physical or non-physical. Our ordinance should be amended to ensure it fits the purpose, and such amendments can be slimly made and should not be controversial. Another illustration. After many years of deliberation, the Law Reform Commission published its report in 2021, causing or allowing the death or serious harm of a child or vulnerable adult. Failure to protect offense, in short. Because a young child or an infant is unable to tell, there is a problem answering the question, who had done it? Essentially, this law says that any person owing a duty of care to a child or vulnerable person and knowingly fails to take steps to protect that victim from serious harm or death would bear criminal liability. So this law offers incentive for early prevention and intervention rather than a primary purpose to impose punishment. It is hoped that government accepts this law for prompt legislative enactment. Now I move on to procedure and practices. Our response systems to child abuse has matured over the years. This procedure guide underpins the practice of child protection in Hong Kong. The key words are child-focused, safety first, family participation, multidisciplinary cooperation, child's best interest, and the rights of the child. These guides assist professionals in the identification, assessment, immediate actions, risk assessment, social, medical, and criminal investigation, as well as decisions on case nature and welfare plan. Now, annexed to the procedure guide include chapters on information sharing and confidentiality, the roles of different sectors and professionals, the different assessment tools, how to handle abuse disclosure, and the relevant ordinance related to child protection work. Now, deficiencies in practice are bound to be present. For example, the different steps in identifications, reporting, handling, and so on. These terms, consult, report, and refer, are clearly defined in a revised guide to sharpen up communication and delineate roles and responsibilities. This slide depicts the typical journey of an abused child with injuries, having to go through evaluations by various parties. They may need to attend court or be placed out of home. Pediatricians in the public hospital can arrange direct admissions for suspected abused children to avoid repeated interviews and to reduce secondary trauma. Further, child-friendly provisions are in place in the ward and during evidence collections. Provisions in the evidence ordinance enables information in a video recorded interview as evidence in court. And the criminal procedure ordinance enables a child witness accompanied by support person to testify in court through live television video link. Now, the handling procedure has a core component, the MDCC, where informations are shared, the case nature is decided, and the welfare plans are drawn out. It's participated by disciplines from various disciplines, school, social work, doctors, nurses, police, etc. And there is also participation by the family in the MDCC, which can be healing when appropriately managed. On establishment. In 2021, abusive acts in the Child Residential Institute was reported by the public, and over 30 staff from the institute were charged with over 100 counts of assault on the 40 child victims. Now, this is a statement by Against Child Abuse on the matter. The community asked for improvements in the existing laws, policies, governance, training, curriculum, social support, etc., to guarantee child's rights to protection. More so, the comprehensive preventive strategies and child protection policy are asked for. After the incident, remedial actions were undertaken very promptly, and extensive reviews of the residential childcare and related services were conducted. Improvement measures are being implemented in service quality, service regulation, monitoring, planning, and provisions. More on establishment. The Child Fatality Review was established in 2008. The review is based on information from the coroner and involved agencies. And the review panel examines service delivery process, identify good practice and lessons to learn, keeping in view the implementation of the recommendations, identifying patterns and trends, promoting intersectoral and interdisciplinary collaboration to prevent child death. And it is appropriate that a review of such a mechanism is needed now for further improvement. And I will illustrate with an example on the work of the review later. More on establishment. For many years, our community has asked for an entity with authority to specifically look into the well-being and development of children. In 2018, the community welcomed the establishment of the Commission on Children. It is chaired by the Chief Secretary for Administration with membership from relevant bureaus, secretaries, heads of departments, and community members. The terms of the reference of its members are to develop policies, set strategies and priorities, and oversee their implementation, integrate and rationalize different policy across bureaus, departments with advisory bodies. And promote and promulgate child's rights according to the United Nations Convention on the Rights of the Child, manage funding schemes, and develop a framework with indicators to achieve its vision. Now, data drives policy, budgets, allocation, service developments, and outcome monitoring. We have a very mature system to handle child abuse. Very valuable data can include rate of re-abuse, frequency of reason, and reasons for change in caseworkers, children under care or protection orders, adherence to the MDCC recommendation, etc., etc. It is very good that the Commission on Children has vulnerable children as a priority when setting up the central data bank. Now, more on services. There are plenty of literature on evidence-based prevention programs. For example, the application of nurse home visitation program has been shown to reduce child abuse and neglect, lengthen the time to subsequent pregnancy of young mothers, reduce criminal behavior, increase graduation of these mothers with honors, reduce hospital stay, increase maternal and child functioning, etc. However, evidence-based home visitation program for at-risk families has not been made a mainstream service in Hong Kong. These home visitation programs are run by ACA and target specific groups in need. For example, in China, daylily is called a flower of mother, and it symbolizes resiliency. And the daylily project supports young or single mothers. And these programs are funded by different charities, and it is only strategic that such home visitation service should be made part of the child abuse prevention. More on services. The brown color line shows a very low number of child neglect cases in children aged less than 2 from as far back as 2005. In Hong Kong must wake up to the role of drug abuse in child abuse and neglect. A letter to the local newspaper to raise awareness on the harm on children in drug-abusing families and to call for professional collaboration. Such harm is called hidden harm because it's not easily identified, and we know little about the problem, for example, its extent and the children's well-being. Around 2014, an initiative by frontline professionals resulted in a practice consensus. Pregnant mothers who abuse drugs are linked up to the Interdisciplinary and Cross-Sectoral Comprehensive Child Development Service, CCDS. Drug-taking problems is managed in pregnancy period by social work and health professionals. Newborn babies of these mothers undergo urine toxicology testing. This practice was later formally recommended by the Child Fatality Review Panel 2017. A positive urine testing of a newborn will lead to case conference where child neglect is considered. The diagram shows a sharp increase in child neglect cases after such identification practice. However, this is a confined group of newborns, and information on other drug and alcohol abusing families is limited. We also know little about the effectiveness of different models of intervention. One point, professional collaborations remains the key to successful management. Apology for this busy slide. CCDS was piloted in 2005 and implemented in the territory from 2013. It targets children in high-risk situations. For example, maternal substance abuse, mental health problems, teenage mothers, and it aims to facilitate children's optimal physical health and development, preventing child abuse. The program achieves early engagement of drug-abusing expectant mothers during pregnancy. The many charts in this slide demonstrates that an early integrated program with multidisciplinary collaboration was an independent factor in improving developmental outcomes of vulnerable children. It's glad that this pioneer program for drug-abusing mothers had led to similar programs in other counseling centers for psychotropic substance abusers. And the government has committed to regular service provision from 2023 and 2024. Now, having commented on the CCDS, I think you would agree that professionals working in the child protection, such as CCDS, have a challenging career pathway. Expertise, collaborative efforts, and skills are difficult to come by and should be retained with every effort for the betterment of children. And we hope a review on CCDS is timely on its overall governance, manpower succession, service model, infrastructure, and outcomes. And in this table, I have attempted to summarize different parts of the child protection system in Hong Kong, and I have only discussed some of them today. The blue ones are those we have in place and to be enhanced, and the red ones we have to work on. So there are a lot to understand about child protection system. I hope that you will understand more on our work in Hong Kong. Lastly, I'd like to leave you with these words. Many thanks to IPSCAN for this platform for us to share our challenges, achievement, and vision in child protection. Thank you for your attention.
Thank you so much, Patrick. I want to let the audience know I just put in the chat again the link to Protecting Children from Maltreatment, the procedural guide that Patrick shared. It is such a wealth of information, Patrick, and engaging multiple disciplines in the process. It goes from the initial assessment to the follow-up with all the disciplines outlined in their roles. It's such a great piece for you to share with us. So thank you so much.
Yeah, thank you.
And again, we appreciate you sharing the great work that's happening through your organization as well. And now we'd like to turn it over to Ayako to share her presentation on the efforts in Japan.
Thank you, Jane. Hello, everyone. Good evening, maybe for somebody. I will be presenting from Japan. Super Aging Japan is finally steering toward a child-centered society, and I would like to first introduce myself. Let me see if it moves. It does. I would like to introduce myself. Hello, my name is Ayako Ishikura, and I work as a pediatrician in a general hospital in Japan. My hospital collaborates with the community organizations to support children and families with vulnerability, prepares bi-monthly seminars concerning child abuse and neglect, and functions. Our hospital functions as one of the medical centers of the area's sexual assault response team. I'm also a board member of JASPCAN and JAMSCAN, and I have been a president of the 11th Annual Congress of JAMSCAN in 2019. Here we go. Well, Japan is a super aging society that no other society has experienced. Newly born babies have been decreasing at an unprecedented pace. In year 2000, the population under 15 years of age has become less than the population of 65 years of age and over. This is a graph showing the number of cases of child abuse consultations handled by the Child Guidance Center in Japan. The Child Guidance Centers are the correspondent with the Child Protective Services. You will notice the count starts in 1990. This is when the Ministry of Health, Labor, and Welfare started collecting statistics. There has been the Child Welfare Law that was enacted in 1947, which provided for mandatory report of abuse, on-site investigations, temporary custody, and so forth. But this law was not effectively exercised, neither by the public nor by the Child Guidance Center itself. In the 1990s, child abuse gradually became a social problem in Japan. The driving forces behind the emergence of this social problem were more media coverages and increased prevention activities from nonprofit organizations and the ratification of the Convention on the Rights of the Child in 1994. In the year 2000, the Child Abuse Prevention Act was enacted, and cases reported and handled have been rapidly increasing. On the other hand, the focus was on detection of abused children, and in those years, the protection of rights of the maltreated children meant separation from their perpetrators and placement under social care if necessary. This is Article 2 from the Child Abuse Prevention Act that was enacted in year 2000. It defines child abuse as child abuse neglect is abuse of a child by a guardian who is parental authority over a child under age of 18. Perpetrators of maltreatment are limited to parents. For example, if a mother's boyfriend or girlfriend is not taken as a parent, even if he or she takes care of their partner's children. So if they abuse their partner's child, it is defined as neglect by the parent. Moreover, caretakers outside of the home, such as teachers and daycare providers, are not regarded as perpetrators of child maltreatment by this act. The president of a famous entertainment company in Japan has been abusing numerous boys for many years. He is recognized as a criminal of sexual assault, but by definition, he is not counted as a perpetrator of child sexual abuse. The 2004 amendment of this act made suspected child abuse cases subject to mandatory report. In this way, child abuse began to be recognized by the public, and mandatory report of suspected child abuse cases increased rapidly. The number of cases of child abuse consultations handled by the Child Guidance Center has rapidly increased from 17,725 cases in the year 2000 to 219,170 cases in year 2022, a 12 times increase. In 2004, the Child Welfare Law was also amended so that the municipalities could set up regional council for children in need of protective care and information sharing for supporting families and children facilitated. Preventive measures such as infant visitation and child rearing support policies gradually increased, leading to a major revision of the Child Welfare Law in 2016. The Child Welfare Law was largely revised in 2016, and for the first time, it clearly stated that the children are the subjects of rights, and the previous state of child welfare was finally reviewed. The two major points of revision of the Child Welfare Law was that it based itself on the rights of the child, and the other is that it focused on children in foster care and states that the children should be provided with a family-like environment from infancy. The Child Welfare Law in 1947 focused on saving children's lives. Protection was first priority, that is separation from parents, and children's voices were not considered important. In the Child Welfare Law 2016 revision, Finally, children were recognized as subjects of rights. In Article 1 of the law, the words, "In the spirit of the Convention of the Rights of the Child," was clearly stated. Judicial involvement in parent-child separation was stated, but specific measures and system as to how to involve family court is yet to be developed. The Child Guidance Centers is still separating children from their parents without judicial judgment, which is breaching the CRC Article 9. Launch of Listening to Children's Voices system and all the other changes are based on children's rights. Domestic activities have begun to move little by little since the ratification of the Convention on the Rights of the Child in 1994. There were also repeated recommendations on the UN Committee on the Rights of the Child. The Fundamental Law for Children was passed in 2022. It states that all children, regardless of age and in the process of physical and mental development, are covered by this law, and that all children are respected as individuals, their rights to development guaranteed, opportunities for participation and expression of their opinions ensured, and the best interests of the child given priority in accordance with the 4 principles of the CRC and the spirit of the Constitution of Japan. It is stated that priority will be given to the best interests of the child. In the absence of a national system to comprehensively oversee child policy, the Children and Families Agency was established in 2023 to solve the problems of vertical division between ministries and agencies, horizontal division between national and local governments, and chronological division of systems and ministries depending on the age of the child. The basic policy of the Children and Families Agency is to always put the best interests of the child first, place child-related initiatives and policies in the center of our society, and from the perspective of the child, look at all environments surrounding the child, guarantee the rights of the child, leave no child behind, and encourage the healthy growth of the child throughout the society. The purpose of the Children and Families Agency is the realization of a child-centered society. In 2023, Children and Families Agency was established as a bureau of the Cabinet Office. The agency is given a control tower function, an interagency coordinator function, and the agency will give recommendations that will be directed to other ministries, such as the Ministry of Education, Culture, Sports, Science, and Technology, and the Ministry of Health, Labor, and Welfare. Now that there is the Fundamental Law for Children, not only the Children and Families Agency, but also every citizen need to work together to realize a child-centered society. In Article 15 of the Fundamental Law for Children, it states, "The national government shall endeavor to publicize the purpose and contents of this law and the CRC to the citizens through public information activities and to obtain citizens' understanding. The people shall, in accordance with the fundamental law, deepen their interest in and understanding of the policies for children and endeavor to cooperate with the policies for children implemented by the national and local government." Japan has received multiple recommendations from the UN Committee on the Rights of the Child. Especially these 3 points were pointed out. The Fundamental Law for Children was enacted in 2022. The Children's and Families Agency has been established in 2023. Yet to realize is a system to catch and reflect children's voices to recommend policies that contribute to further guarantee and realize children's rights. A commissioner system with persons who are independent of other administration is in need. The issue is to establish an independent system that listens to children's opinions and proposes measures that contribute to the realization of children's rights. There are still more steps to actually realize a child-centered society, but Japan is now on the change. Thank you for listening.
Thank you, Ayako. What a great presentation, and thank you for sharing the current state in Japan. I loved how you showed the evolution of going from saving children's lives to protecting children's rights and what that really looks like in regards to the movement of the government. So again, thank you so much. And now I'd like to turn it over to Yogesh and Gracia.
Thank you so much, Jane. Just want to thank IPSCAN for inviting Singapore to be on this panel. And for Singapore, we're going to be sharing on reimagining child protection ecosystem to support families. My name is Yogesh. I'm a senior principal social worker with Child Protection, Ministry of Social and Family Development. And I worked in Australia and Singapore, and I'm currently doing my PhD in trauma-informed supervision. Gracia.
Yeah, thanks, Yogesh. I'm Gracia, one of the senior directors in Singapore Children's Society, which is an independent charity. I've had the privilege of working with children and youth in a residential care setting and multi-stressed families through our intensive reunification service. Yogesh and I are very happy to be sharing with everyone today.
Yeah, so we're going to share this in partnership, and that will reflect actually what message we also want to communicate. Yep. So one of the things is really around Singapore's child protection system, right? I'm going to talk a little bit about the context, the key pillars, and also the strategic levers that actually aided the transformation efforts, okay? But our main mission is to protect a child's today, to secure a child's tomorrow. The longer-term stability and safety of the children is important, and we also want to ensure that there's no re-traumatization. Okay, in the next slide, I'll show you a little bit, okay, about the local context, right? So if you look at it from 2013 to 2021, there has been an increase in number of cases, but after 2021, there's been some stabilization of the investigation cases. A little bit on why some of the why there was an increase, okay? So this was something internationally, I'm sure a number of countries here today have also noted, which was about the pandemic. During the pandemic, there was an increased parental stress, job instability and all that did contribute to child abuse cases. The next was really increased detection and reporting. So, you know, for the Break the Silence campaign, which is actually focused on violence, and we do know that there's co-occurrence between family violence and child abuse issues. So we saw an increase in that number, and there was a lot of effort to address that. Okay? In terms of context, right, there are multifactorial considerations in a case. So if I first, maybe I'll start off first with the work nature, okay? Work has two elements. One is, of course, the actual workload, you know, the amount of work that the child protection officers will face. The other is, of course, the emotional toll, which is the psychological emotional aspect. So in terms of the vicarious secondary traumatic stress, then one can encounter even as you're working with cases. And I think we also saw client aggression, clients who are unhappy. Some were very aggressive, but some also went to take, you know, increase in legal challenges because of that, because they did disagree with child protection decisions. And also, of course, there was a lot of managing of expectation and acrimonious situations. Okay? Let's look at the next slide. Okay? So these are key pillars of child protection work. At the core, child-centric trauma-informed practices are fundamental. So we focus a lot of that, but we also partner with parents because they are key stakeholders. And we do take a strength-based approach despite the difficulty or complexity and the challenges that, you know, that we face as we work in these cases. Legislation and the framework is very basic to the work we do. And later I'll talk a little bit about how the amendments has also helped in our transformation efforts. Okay? Interagency, very swift and tight interagency sharing has actually helped many cases. So we do set up a network, which I will share later, in order to make rigorous and fair decisions in child protection. There's evidence and data-informed decision-making practice. So we are informed by tools. Later I'll share a little bit, and this is very fundamental. The next is competency building. If I can show you a triangle, right? In competency building, there's training, supervision, coaching. All three are very basic and essential as we kind of hone the skills together, whether it is MSF or sector partners. Okay? And also the multidisciplinary decision-making platforms, which I think just now, Patrick also shared a little bit about it. Having the multiple perspective does give additional weight to the decision-making. Okay? And of course, community support, which we'll emphasize a lot. So this is a visual map of the agencies that child protection work with to actually form the system to support children. We also have social service agencies like Gracious Singapore Children's Society, where we partner to really maximize the strengths to help children and ensure longer term safety. Let's look at the next one. Okay. So legislation is Children and Young Persons Act. Okay. This is the main legislation providing for the welfare, care, protection, and rehabilitation of children and young persons in Singapore. So, of course, the ongoing issue is always balancing the parents as guardians and primarily responsible for the care and welfare of the kids with ensuring that the welfare and best interest of the child is put first and is paramount. Okay? So there are a number of key powers under the Children and Young Persons Act that allows us to do our work. Okay? It allows us to get information, look at also when do we place a child on temporary care protection, giving us the power to also provide for children in need of care and protection through court orders. So these are the amendments that happened in 2021. Okay. So if you look at wanting to better the protection and rehabilitation, I'll just pick out three of it. One was the change, which was the increase from age 16 to 18, so that children age 0 to 18 are covered under the legislation. We also enhance the care and protection for children's stability in their care arrangements like foster care around decision making and all. The other one was the appointment and training of volunteer welfare officers. This is really mobilizing community and giving powers to be able to help with support the work that is done to ensure children's safety. Okay. So this picture shows the tiering of cases in Singapore. So we have the high-risk cases, which you can see in red, which sits under the statutory child protection intervention. Okay. This layering is also to ensure families receive the right dosage of services. The second, which is middle, which are specialist agencies in child protection, which we train and partner very closely as well. We do also partner with community agencies that provide generic services for family. And all this actually kind of maximize the child protection ecosystem and leverage on their strengths. Okay. One of the transformation efforts is really adopting evidence-based informed assessment and decision-making. It's a case management tool, structured decision-making, known as SDM. Okay, so we use this to actually make key decisions at intake, investigation, intervention, and also making decisions about when children return home, and also when cases come in, and also working out case plan and all. Yep. This is the other transformation effort was really emphasizing families. Okay, we wanted to emphasize families and family-based care. So you can see the link, I think later on, Jane will also put it in your link, which is actually a practice guide that we had created to document the type of interventions that go in supporting families intensively. In the next slide, you will see, okay, we have SSFP, which is preservation, and SSFR reunification. We started this in 2016 as a pilot, and then after that, it's in steady state at this point in time. So it's intensive, like 2 times a week, intensively helping the family build their capacity. This slide, right, was actually from about 30 families from SSF. We actually did a qualitative analysis to really hear the family voices, did the program work, how was the family's experiences? So I picked out 3 areas, okay? One of it is that they really felt that the relationship between the parent and child improved because we know the meaning of the child is very critical in building that part so that there's a lot more attunement and relationship, okay, to prevent abuse. The other part is the improved relationship. So you can see, right, my mother was quite distant, asked to move out. So like our relationship became closer. No network, no safety. So the family coming together and relationships built in a strength-based intervention model is very important. Okay, so cool. So next one of the transformation efforts was really setting up in Singapore a national anti-violence and sexual harassment helpline. So before 2021, right, 2021, there were multiple lines of reporting. So this is to also improve client experience, reduce confusion so that they can access. This is a 24/7 one-stop service. Okay. So later on, there were also revisions. So one of the things in Singapore is we get the feedback, we revise, and we see how to enhance the process very quickly. So sexual violence as well as web-based reporting. The next transformation effort is digital transformation. Okay. Really thinking not just now, but the future of how child protection will be and how our children will be kept safe. So I'll just pick out a few. So you can see on the left hand was the virtual reality simulation. This is actually where those who are applying to child protection, we actually let them go through scenarios and also to get their responses. Because child protection, you use a lot of self and your responses are very important. So this helps us assess. The robotic process automation and digital filing, these are repetitive tasks that with technology can ease the workers, the child protection officers' workload. So they were put in to help them and to actually speed up processes. Okay? And of course, there's geospatial analysis. Targeted interventions are important. So knowing where in the community there are higher cases, the type of cases, helps you target the intervention in a more intentional manner. Okay, so let's look at the next transformation. Yes, this is honing our craft together, deepening competency together, sector and MSF. So you can see Gracia and me there also in the protective behavior training. So what we do is we train together. We also partner sometimes with external consultants who have been very helpful, our Institute of Higher Learnings, so that we are growing together and having common language and also building leadership together. Okay, so let's look at the next one. In child protection, right, having supervision frameworks and deepening that is very, very core, because that's how we build and actually ensure sustainable practice for quality outcomes. And it also ensures care of the professionals. So in Singapore, we looked at supervision paper, we looked at integrating trauma-informed principles and also supervision of supervision, because this group is very important as well. And also evaluation to ensure that we're doing what we said we were going to do and improving. Gracia, on to you.
Thanks so much, Yogis. And in Singapore, our non-profit or non-governmental organizations are called social service agencies. Singapore Children's Society is one such SSA. So we focus on serving children and young people in our country. And last year, we reached about 18,000 of our target clients through our 12 service centers. Here you see a quick map of our footprint that's around the island. Services for vulnerable children who have been maltreated, they fall under one pillar of our strategic focus. So under this banner, we provide both residential and reunification services. We really want to honor today all of you here who are invested in the business of protecting children, and each of you who knows a child who has suffered has met with deep pain. So we are going to avoid telling you more horror stories today. But we do need to talk about the patterns that our children have told to us, that despite our best intentions, they are still suffering. So what are some of these common scripts that children who have been removed from their homes tell us? Firstly, I'm safe for now, but what awaits? We know that children and young people who have had 4 or more adverse childhood experiences are almost 5 times more likely to develop depression, 12 times more likely to attempt suicide, amongst a host of health and social problems. Every placement breakdown in itself is a traumatic episode. All relationships I know are temporary, not dependable. I cannot trust this world. I have zero control over what happens. Fundamentally, I'm flawed. So there's no need to try. How healthy our child protection system is today must be measured by how healthy our children are. So if we stay only at keeping the child safe, then removing the child from their home is just the start of another nightmare. So to reimagine how things can be is anchored by how our visions of how things should be that's in the best interest of the child. Can we as a collective detect risks earlier? Have we explored every necessary support to help the family provide safe care? If not birth parents, what about kin, foster carers? But if a child must stay in out-of-home care, what about their well-being needs? Is there mending for what's broken? Is the child heard and seen throughout the process that keeps changing their life trajectory? Can we be confident that the child will not just be safe today, but also well tomorrow? And you heard from Yogis that to address each of these goals, our entire infrastructure in Singapore went through an overhaul. So many changes, right? From legal amendments to service development. But what really happened on the ground? Do good intentions really translate into better lives? One thing that happened for sure, the context in which our precious children are nested in, it went through radical changes over the past 5 to 10 years. And that's the arena where policy translates into practice in the community, in both areas of processes and practices. So 4 key pieces that shifted our culture of protecting children away from child safety only to being both child-centric and family-focused. And the very first is in early detection of child maltreatment. Standardized tools, common language to help not just social workers, but teachers, healthcare professionals align on definitions and agree on when to take action, what kind of and how much interventions. But what happens with an improved radar system? We know that structure drives behavior, and it can be reflected in data patterns. And our numbers do tell the transformation story. So from the time that as standardized tools were being introduced in 2015, along with increasing momentum of public campaigns, we see that the numbers of child abuse investigations actually surged almost fivefold in 1 decade. The uptrend line shows the new cases investigated year on year, but in dark green, we see the number of children removed from their homes into out-of-home care remain fairly stable. So how did that happen? Vision followed by action. So we'll take one example, that vision of having family first before institution. The yellow line shows the number of foster placements that's rising, while the number of children in institutions decrease in tandem. And behind this, 5 social service agencies were recruited to set up fostering agencies. So vision followed by action. But every one number is one life, right? So that means not just more children in total, also with we have more children with high and complex needs at our front door. So we cannot just detect better and then leave the whole system jammed. It will crumble. So structural changes had to take place very quickly and sustainably. And to do so, the SSAs were co-opted as service providers at every stage of the process, from manning the hotline through assessments to interventions. Community agencies were trained and coached, like what you heard from your guests, along with the Child Protection Department. And what happens within the SSAs is that we have to redesign job roles, right? To build up a stable layer of supervisors who can manage the entire risk continuum and sustain that. To stay responsive to the needs of the individual child, we also had to reorganize our services at structural level, bearing in mind our shared goals, child safety and family first. So all the agencies that you see here together with SSF services in yellow, they converge to build a stronger and safe family. And while the referrals keep coming in, interim placement centers hold and assess the needs before routing each child to a suitable care setting that is best matching with the unique individual's needs. Foster placement before institutional care and specialized interventions for children with higher needs to heal and recover. So what's infused into these differentiated care models are trauma-informed practices, structured approaches, and therapeutic interventions, so that, number one, our child's well-being needs are met, and number two, the underlying issues in the family that results in the abuse and neglect are being addressed for resolution. We'll give an example of a structured intervention we use, the Partnering for Safety approach. It emphasizes heavily the collaboration with the family and the network, as well as the child's voice and participation. So we literally will have the child review the progress of the case planning, as well as the assessments, be involved and be seen and heard. And that is emphasized throughout the process. Sonia Parker is the author of these materials, and she has generously made this freely available. So we've left there in the link as well as the QR code. So you can go to our webpage or scan this for an amazing treasure of tools. Jane will also pop into the chat now, both the skinny cap you see here, as well as a fuller version of the template. You can download them if you wish to. But this is just one example of a structured intervention. I'll just show you that in the community, we use a whole host of other structured interventions with our multi-stressed families. These are evidence-informed therapies and practices, and it's important because it's not just about developing that trauma-informed milieu. We also have to have targeted interventions at both the individual and the family levels. So these are it's a quick short list of some of the therapies that our practitioners in the community use. So you see it's quite calm on the water surface, but then it's very important to know what lies beneath. In less than 1 decade, Singapore actually launched an policy and program initiatives one after another at the front line. Right? The new news keep coming up, the setting up of all these agencies. But this means that our social infrastructure needs to be prepared in advance to respond to our clients well. And the whole system really heats up. The key thing to take note here is that it really requires capability and capacity building in every corner in advance, because we know that upskilling takes time, and the people who absorb that value and that stress are our frontliners. So if we only train the people that we recruit, but we don't retain the people that we train, our system remains in perpetual crisis. And we all resonate, right? Our countries have aging populations, and rapidly so. So we're all too familiar with the fact that increasingly we just have less and less young people to do more and more work. So we cannot afford to burn out our few good people. And on this note, we really want to acknowledge and honor every individual who have been in this arena doing your level best to make things work. We want to thank you. So in closing, Yogesh and I would like to share some of our reflections in powering our ecosystem in protecting children through our partnerships. 10 critical factors. Firstly, a genuine mutual respect for each other in our equal partnership that is grounded in that common ground, which is the best interest of the child. This has been to be done through a rigorous and systemic process of reviewing our implementation, because we cannot just look at what's best practices elsewhere and expect the same results in our context. So joint learning and experimentation. People say Singapore really love pilots. We pilot everything. We pilot for quite long also to make sure that things work before we scale. And these implementation reviews also allow us to listen to our pain points in very honest fashion so that we keep tweaking what's not working. And what do you say, okay?
So I think one of the things is, while we look at the implementation science and we apply, the people in it are so fundamental, right? So one of the things that we realized was helpful is taking relational risks. So between organizations, whether it's government or sector, giving feedback honestly, and sometimes having to respectfully challenge to say, hey, look, this is not working. How can we fine tune it? I think earlier on, you heard the practice circles and joint trainings. They really help build the practice development, because in addition to processes, people are also very important. Okay. So Richard, through sharing resources, and I think this point Gracia said, the government also focus on strengthening community, because we want to strengthen together, right? And also what was evident is jointly there was a spirit of innovation. Why don't we try to change systems? Why don't we make them more responsive? Okay? So in the next slides, we talked about if we just putting together elements of reimagining the state of child protection in Singapore. Okay. So if we had child protection workers have reasonable caseloads, and also the community is supporting the professionals, they'll be thriving and competent professionals who are inspired to continuously do this work, because a lot of them come in with a lot of passion. And of course, we talked about the seamless partnerships between government and sector. Okay. And we also talked about the next point, which is actually around prevention of child abuse efforts owned by the community. So such as protective behavior, how can we do prevention effort to actually help? And every child and family will have a strong and reliable network, so sustained safety is ensured. And if we were to do all this, right, including ensuring that past protection, child protection families are also involved to support current families, Gracia, what will happen? What is our dream state?
So our dreams are really to put the child in the center, so that they're not just safe today, but they are well tomorrow. They feel loved and belong, and they know their rights and believe that they are worthy. That's really what we hope for the children, not just in our countries, but in each of our arena, so that they can be well. Thanks very much for listening to us.
Okay, so in a multicultural way, we'll say Nandri, Tamil, thank you.
And 谢谢你.
Bye-bye.
Thank you to both of you. I have to be honest, when Gracia and Yogesh shared their presentations with us last night in our practice session, I think our reaction was all the same. All of us just said collectively, wow. I mean, Singapore has shown us a gold standard of the engagement and the partnership and the synergy between government and NGO. And obviously, the impact it's having on children in your country is unbelievable. And I love that slide that you shared, the joint reflections, the 10 key factors of partnership and working together. And again, I just really am in awe of what you've achieved. So thank you so much to both of you for sharing it. And now I'd like to turn it over to Fran. Fran, we're looking forward to your presentation.
Thank you, Jane. Hello, everyone. My name is Frank Gao. Today, I'm going to present trauma-informed care and the child welfare system, the challenges of shifting paradigms, the Taiwan experiences. Okay, so let's look at, give an overview of Taiwan's child protection system. Oh, that's me. So I'm currently the Chief Operating Officer, Center for Child Trauma and Resilience, and my agency is Child Welfare Lee Foundation. Okay, so let me first give a brief introduction to child protection system in Taiwan. And for the legislature process, you can see back in 1973, we first passed the Child Welfare Act. That's the beginning of a long history of legislation. Until 2003, Protection of Children and Youth Welfare and Rights Act is the foundation of our child protection system. And since since 2003, as of today, the act actually has been amended 15 times. So you can see we actually are moving towards improved early warning and early intervention systems. So with the mandatory follow-up services and mandatory parental education, we're hoping that we can get into the families with assistance and services. So hopefully we can prevent more further damage. And then if you look at the statistic for now, with the rising awareness of the issues, the past 5 years from 2019 to 2023, the reported cases are on the rise. And most of these cases are investigated, and only 20% of the cases were open. We'll talk about that later. And then from this chart, you can see the identified abusers in 2023. Majority of them were in fact parents, okay? Parents of the children. And from this sort of complicated diagram, you can see over the past 5 years, over 25% of the victims of child maltreatment were between the age of 12 to under 15, followed by 15 to 15 to 18. So actually teenagers are have the highest rates to be abused. But then if we look at the other numbers, okay, 70% of the death that due to abuse, neglect, and filicides were actually children under the age of 6. So younger children are most vulnerable in terms of abuse and neglect. It's very detrimental that in fact that they have the highest fatality rates. We look at the current policy implementation. Our government are creating more programs in terms of home visiting services and also parenting stress relief services. And then we also try to empower the families. We wanted to get into the family as soon as possible, and we wanted to empower the parents. So we have parental empowerment services for parents, especially with children under 6. And then we also created regional medical integrations services for the protection of children. So these are all the trend for child protection. But then we also are encountering a lot of challenges. First of all, the high caseloads. So in 2023, we have 56,000 reported child abuse cases. Okay, and then so all the social workers are busy investigating these cases. So we can see their caseloads after they investigate and open the cases. A lot of them have very high caseloads. On average, it's actually 35. So it's pretty high. But then if you look at the open case cases, that's only 20%. And we are also short of 610 social workers. These are the frontline social worker. So that means the shortage of workers that just make their life even more miserable because their caseload is unbearable. So make you wonder if that has something to do with the low open case rate. And then if we look at the services, okay, the intervention, even though we're hoping to get into we're hoping to get to work with the family as soon as possible, but in fact, our preventive services is still inadequate. The resources allocated for preventive services and also for aftercare services are definitely not enough. So that just means throughout the recovery process, our family a lot of time are left without services. And while the case is still open, then we also see the problem between different disciplinary teams. Okay, so justice system or the police, education, and social services, a lot of time they don't share their information or just not enough. And then also with our current culture, there is this blame culture that put a lot of pressure on social workers if they fail to detect any kind of signs of danger or risk. Even though we also follow the guideline of SDM, but then there's no guarantee that you're able to catch every cases. So they are being watched closely and want to make sure that they don't miss any case. But that's just make things really, really difficult for frontline workers. And then we want to ask the question, why do we need trauma-informed care? As we all know that adverse childhood adverse experiences will affect the brain development of a young child. And trauma-informed care, in fact, is a framework for human service delivery that based on the knowledge and understanding of how trauma affects people's life, and then also to determine the service need, and then to plan for the service plan. Rather than exploring the symptoms, we wanted to screen the family and the children for previous trauma history or exposure. So we wanted to make sure that this is brought to the attention of the protective service workers, and then so they can better assess the needs of the children and the family. Being a social worker myself, working for the agency that has been in existence for 33 years, it is painful to see children and families who continue to suffer and also get into this revolving doors situation that even with reported cases, sometimes is found it's not open, but then within a very short time, their case will be reported again. So we said to ourselves, we need to push the system forward. So we begin our journeys actually in 2020. So we want to push the government towards a trauma-informed care system. And then so we started our movement and started our work to push the government to put in the energy and resources in interdisciplinary coordination. So with the healthcare system, we play an instrumental role in advocating for the 11 regional medical integration centers for the protection of children and youth to have to begin the trauma-informed services. So in addition to injury assessment and treatment, they all have to incorporate the concept, and then they have to help children and families to recover from trauma. And then with social welfare system in 2022, my agency was contracted by Department of Protection Services to train over 1,200 protective service workers around the country on trauma-informed care. Also, we came up with the trauma-informed care and practice in protective service handbook for all the social workers in the field to hopefully rely on. And we work with the education system, and we'll provide the teachers, guidance counselor with a toolkit, and then for them to learn about trauma-informed care. We also we also translated and published translated the WHO school-based violence prevention handbook. We translated that into Chinese and published it. So the schools has a better understanding of how to prevent bullying and violence within the campus. We also done a lot of workshop throughout the years to help teachers to grasp the concept and also to implement it in their day-to-day lives. Also, we put our energy into juvenile justice system, started in 2023. We collaborated with the Institute of Violence, Abuse and Trauma. We together identify stakeholders and build system of care to address the needs of juvenile justice involved youth. And we invited Judge Robert Mark Brownlee, and he was the First Circuit Court judges of Hawaii, and then he conducted training for our Judges Academy. Hopefully, that with his work, that our judicial system will have better understanding of how trauma-informed care can be incorporated into juvenile justice system. And then for our work, we look at it as something that we need to start, but we definitely feel that it should not be a bottom-up movement, only from the NGO point of view. We certainly wish our government will take the lead to create more policies, and then to also start working with different sectors and then interagency collaborations. So we see the needs for this paradigms to be shifted, and then we want this this system to be rather than reactive and problem solving. We're hoping that child protective services and the whole system can be need-based and trauma responsive. And this is just our vision for the future. And also we're definitely in the process of making it happen. So we're asking all of you to join us to with this work. And then hopefully with all of us that we can make this happening even sooner for our children and family. Thank you all.
Thank you so much, Fran. I love how you talked about trauma-informed care training in healthcare systems, social welfare systems, education systems, juvenile justice system, not just in treatment, right? And having it permeate through all of these important pieces, you know, in the systems, child protection system. Again, really incredible work that you're doing. Thank you. And at this point, I'd like to invite all of our panelists to turn their mics on and their cameras on. We have a lot of questions and a lot of great comments, and I'm hoping we get to all of them. I'll do my best. And some of them I'm just going to throw to the panel. They weren't directed to a particular presenter. So I'm just going to go right to it. There was a lot of questions about really about funding. You know, I think when we look at what's happening in Singapore, I think were some of the comments that came, you know, the amount of movement and growth and the collaboration that I think we're all impressed with. That's also supported by funding, right? Government prioritization, government funding. You know, I'd really like to hear from our other countries as well. You know, what do you do to drive that funding issue, or how do you manage a lack of funding? How do you create these same, you know, substantive changes in child protection systems potentially without government support and or funding at that level that we're seeing in some of the countries that are seeing the most growth? And I'll throw that out to any of you. So Patrick, Ayako.
I think as an NGO, we like to try out new projects, new initiative, and then pilot it, and then get some results, and then be able to demonstrate to the governments that the program, it works, and ask for a standing sort of provision of such services. And having said that, I think there are a lot of reasons behind to motivate different levels in the community up to the government level. You know, the reasons, for example, incidents and tragic cases and things like that will drive a good momentum. So in building up, leading to the for the funding. So that's my question.
Perfect. Thanks. So that need for public awareness, Patrick, and what's happening in these, you know, high profile abuse cases. And then I like the way you said that really maybe the NGOs drive it first by the creation of the programs, the piloting of the programs, the showing success, and then maybe moving the dial on government funding and intervention. Ayako, and Fran, what are your thoughts?
Us in Taiwan actually follow very similar path. Okay, so as an NGO, we will start a lot of different initial initiatives. And then since we already are the workforce, okay, because we have government funded program to provide direct services. So we first wanted to make our organization trauma informed. Okay, we did training for our staff. We create policies. And then so we want to transform ourselves and then be better equipped to provide trauma-informed services. And then we started to take it to the next level and then talk to the government and say, we can do this if you are willing to allow us to work with the child protective service workers. Okay, and then also, I would have to say the high profile cases that happen, unfortunately, was the force behind government because they don't want to be criticized for letting things happen, the bad things happen. So they will say, okay, then we'll let you try, and then for you to bring in the perspective. And then so we started training, and we also implement the services, the principles into our services. So I think it's pretty much the same as Hong Kong.
Perfect. Ayako, would you like to add anything?
Thank you. I do not belong to the government. I do not, so I cannot speak in place of the government. But just like in my presentation, the government has trying to come up with policies that can contain that work together with NGOs, but the Japanese government have a lot of policies, and they have a lot of fundings for work that they do within the national government and the local government. The local government is coming up with many programs like home visiting and supporting, but at the same time, sharing of information is very difficult within the government perspective. It's very difficult to cooperate with the nonprofit organizations, the private organizations, to share information in order to help promote programs. So we have that sort of problem. I would like to ask questions to Singapore and other countries. What were the breakthroughs? How did the government get to cooperate with these private sectors? There are areas that the government is working with private sectors, but it feels as a worker at with the children, the government seems to have problems coming up with programs connecting workers with the private sector and the government. How did you do it? We would like to know.
Thank you so much, Dr. Ayako. I think you guys will have the $1 million answer to that. But before she shares, I do want to address the impression that our social services are richly resourced. I think that's probably not the reality for us, because we cannot talk about absolute dollars because of how much $1 can buy in Singapore, right? So if we look at our government spending relative to, say, defense or education, our social services are really, the value is truly brought and elevated by the people that we have. So it's not possible to keep throwing money at the problem and to just keep hiring. So we are not far better off in terms of unlimited resources. It's all limited. So that's the first. The second point that Dr. Ayako was highlighting on, I think we resonate so much with that, because Singapore Children's Society, for example, is self-funded for most part, and we depend heavily on that partnership with the private sector. So we have a lot of corporate partners who then sponsor, understand the cause, and come alongside as partners with us, whether it's in terms of funding or even in volunteer mobilization. So there are really extensions in our work with the children. So I'll just stop there because you guys actually will have much more to add. Please go.
Thank you for sharing that, Gracia, by the way. I appreciate your clarification there and, putting to rest maybe a perception that it all came down to funding, because there's a lot of pieces that you put together in this collaboration. So you'll get sorry.
Yeah. And I think because Singapore is very small, right? We are very interdependent. So we know just the government, just the community, we can't just do it alone, and also the private sector. So we partner with all partners to, as we said, create the ecosystem, because we have also learned from the past. So this is something traditionally we've been doing over the years. We really look at tripartite relationships and a lot of partners. So you saw that chart that I drew and all. And I guess we learn from mistakes, not unlike what other countries have also shared in today's panel. We learn, okay, so how do we then need to fine tune together, And I think even community agencies, like what Gracia said, they will also give feedback. So one is, of course, creating initiatives and then testing, but also giving honest feedback, because there's consultations to ask, so would this work, Even when legislative change and all, there's a lot of consultations before we can put it together. So it's a growing issue, not that there are no conflicts, there will be differences, but it's coming to the table and talking it up so that it doesn't in the end affect children and their families, which is the larger goal.
Perfect,
Wonderful.
thank you. That question came up actually about scaling up. So based on what you did in Singapore, and this is really for everyone, not just the two of you, but how do you scale up something to, a large country, with a lot of different, even, whether it's cultural norms different in parts of the country, or whether it's just the sheer geography of it all. Any thoughts on how you scale that up into a larger arena?
Maybe one quick point from me is that we really should try not to scale what's not tested, because when we have some of these pilots that were being scaled too quickly, the pain is really felt across. It reverberates throughout the system, and we have veterans who might drop out of the service because the system is what really eats away at that energy. So that would be key for us. A lot of attention to refining the service model through the implementation process before it's being scaled up.
I wanted to add to that as well. I think with the experience in Taiwan, the central government a lot of time want to move forward, but in fact, the local government may have concerns, because then it will come down to their limited resources, and then also will that create more work for the frontline workers. So what we're trying to do is, in fact, not only work with the central government, but then also to remind them if they wanted to make it into policies, they have to get the local government officials, and also to get maybe have a focus group, or have these procedure done in order to gather information and see where everybody is at, and then come up with something that could be scaled to the level of the local government could actually can bear or sustain. Okay, and then they could have the freedom of starting something not as big, but more towards their own needs. So this is what our experience, what we're trying to do. So we will sometimes collaborate with a local government agency as well to say, let's do this pilot together, and then show it to the central government. So that's what we did. Yeah.
Well, that's perfect. Thank you. And Patrick, did you have something you wanted to add?
I have some noises at the background, but I think one important thing is the foundation. We need to build a very strong foundation on all over the community with different disciplines, the schools, the health, and the social work, etc., so that the standard of care can be elevated. So for example, do we have a curriculum for child protection? Do we have a mandatory training for some basic child protection knowledge and skill to be able to identify cases and then elevate and protect our children? I think this is more important than scaling up and asking for extra money for this and that. So that's my.
That is a great point. Thank you very much for sharing that.
Just one final point to add, just around programs, I guess it's like evaluation is definitely fundamental, but also if we look at the implementation triangle, the competency drivers are also very critical in the systems created and the leadership. If there's really, while you're building a program, you're also building leadership, to actually kind of roll these programs out, and also paying attention to all of it in a very deliberate way is helpful. The other is resources, right? Part of implementation is also sunsetting things that don't work and having the guts to do it, right? Because then you have the resources to put it in the right places. So that's something that I think to be mindful of, to also make such decisions with clarity. Yeah.
Oh, that is a wonderful point. Thank you for sharing that.
Sorry, may I share? There is a question in the Q&A I'd like to address about, asking after the mandatory reporting, what are the sort of measures to support them? Actually, the government has well planned for this, including the training, the online training platform, webinars for multidisciplinary training, and also the government is in the process of making a handling guide, a guide for reporting guide, helping the professionals to make decisions to report. Okay, on the infrastructure, there will be new residential facilities for children if in case the numbers get increased a lot, and there are also increased subsidies for the foster families so that we encourage more involvement of the community to join the foster care. So and also the manpower for for the statutory social workers, etc. So all these are in plan within the next 1.5 years before the mandatory reporting will be implemented. So
That's perfect, Patrick. And that would be for all mandatory reporters in your country? Is that what I'm hearing, this training and these programs?
we have a specific groups of mandatory reporters. But then ideally in a community, everybody has a responsibility. If you see something's wrong, you need to report and ask for help. So that's the main principle.
Perfect. There was a question that kind of goes along with maybe driving change in your countries. Do you find that there are adequate studies being done to address or to assess the cost of not dealing with child abuse in the country? Like, do you feel like there's enough data and there's enough research to really help drive these programs and to drive this change? Like, what happens to a society that doesn't address child abuse? Whether it's financial, whether it's societal, meaning incarceration or loss of workforce, or any of those even economic indicators. Do you find there's adequate research in that in your countries? Fran, I see you're shaking your head. Yes, you think yes?
I think we do a lot of research, but sometimes is well, I have to say this, but sometimes the government will give the indication that this is the policy, the direction of the policy they're leaning towards, and they will ask the scholar to do research in order to support their decision. So I kind of have mixed feeling about it, because that you cannot just think about all this just in your office and then decide what's the next step and try to get research done to support your decision, but rather that should be the other way around. And then that's why I'm conflicted in a way that if NGOs were us, but we don't have the access to the database like the government, okay, that we cannot do the scales of research like the government, because they will allow the researcher to tap into their database, the national database. But then, so I kind of feel that sometimes if we wanted to make sure that it's balance that we will have to be really strong in terms of being the forces on the ground to voice what we need, okay, in order to direct or to make sure the government have different perspectives. Yeah.
Interesting. Thank you. Anyone like to add to that?
Yeah. Oh, I'd like to add that Jane asked us a really difficult question, especially in having to translate social returns of investment in economic terms. It really asks a lot of us, but there are scientists, practitioners, and academics who have jointly supported in this cause. So in Singapore, for example, we do have studies that's also directly related to adverse childhood experiences. So in 2020, for example, we had a joint study between our local university and hospitals that talks about that identified that the lifetime prevalence of ACEs in Singapore is about 63.9%. Yeah, but at what cost to society? We can already extrapolate, right? The cost of the people in terms of the mental health problems, the actual physical health problems, and the disintegration of that family structure. There's so much more in terms of impact that we find it so hard to monetize. So and to signpost to another study that was done by a team in MSF, I think it's in 2019. You guys correct me if I'm wrong. That we looked also at the long-term outcomes, the life outcomes of the children, differentiated by the type of placement types. So that kind of rigor in using hard data to help us inform our whether it's policy or programs or services, we have so much more work to do, and there's much more to mine on this. That's what we'll say.
Perfect, thank you. Okay, I'm going to switch gears a little bit. There were a couple questions about potentially the NGO's role, or just, you know, the systemic change that needs to happen with the high burnout and turnover of child protection system workers. And, you know, how do we properly care for the people who are engaged in these child protective systems? And, you know, again, and whose responsibility is that? Is that driven by an NGO? Is that driven by, you know, a government? Is that, how do we protect this workforce? Any thoughts on that?
We are having a very big problem because of the aging. I think maybe in Gracia or maybe Fran, you were commenting on how the young people who needs to be the workers are decreasing, and we really have to treasure these people who are going to be working to protect our children. And in Japan, they're aging people and they also need care. And there are many people that are in need of care, and there's only a certain number of workforce. And we really have to treasure that. And it's very difficult in the society. This society, if there is an event, a big child abuse death case, then everyone goes into that blame culture. Who didn't do this wrong? Who didn't do this right? Why didn't they communicate? What were the training programs? We go into all that. We really have to treasure these young people and support them and work together with them, and maybe have some elderly people work together with the young people to support that. I don't have an idea about how the government is doing with the programs, but again, I'd like to ask Singapore, Taiwan, and Hong Kong, and how you do it in your societies.
I think the problem is universal in all trades. Child protection, we deal with the tragic case and, you know, all the adversities. But one thing, I think we need to support each other. Okay, from the foundation, from the initial training, we need to have a curriculum. We need to have a training, joint training. We need to map out the career path of these people working in the field, you know, so that they can aspire to achieve at a higher level. And also joining like this type of webinar or occasions will be a very good support for each other. So I think all these will contribute to, you know, to sort of addressing the stress we have. So in the previous organization meetings of this webinar, we are quite happy. You know, we are sharing our commonalities, the similarities and the differences, and we have smiles. So I think that's the essence of the work in here. So.
Also, I think talking about the nature of the work, I think this is something I'm also doing my PhD in. So, but one of the things is also around the organizational context, right? Definitely, because that's the immediate environment. If a critical incident does happen, I think quite a number of the speakers spoke about like child death, but it could be serious injury. And the workers definitely need support. The critical incident stress debrief as the first stop. So they have a space to talk about it. So I think just now, Ayako was talking about like, you know, the after action review. That's the other part. But the care of the worker, the concurrent care while we analyze and learn from it is also very important. So whether it is sector partners in a common case as well as MSF, this part is, we see it as very essential, and also setting up systems within organizations. Can they have breaks sometimes after critical incidents, you know? Is there support in place? So we have something called STOP. They get a 2 weeks break so that they can decompress and have some breather because it is very traumatizing to the body after certain incidents. So we are looking at this very intentionally in the care of the worker and help for the helper and seeking external counseling where needed.
And then also for I think I couldn't stress more is to really build organizational culture in terms of trauma-informed care, and then to really look at the vicarious trauma and then all the secondary trauma of the workers. And also, I think it's important to take care of the supervisors. They're the one that have to bear the responsibility to support their teams. But then if we see them kind of run away from this field, and then you will not have a very strong team to work towards the goals because there's no leaders ahead of them. So I think for us is to really advocate for our organization, private or public, to start building themselves as trauma-informed organizations and to look within themselves to, and also for frontline workers to really advocate for themselves, feel that they have the rights to advocate for themselves. Yeah.
Yeah, I really want to echo what Fran was saying. Some of our counterparts in Western Australia were also sharing with us that when they had waves of transformations, one of the key things that they missed out and they really apologized to the sector is that middle layer. So there is buy-in from the management level as well as the ground workers, but the middle layer is the supervisors and the middle management are not prepared sufficiently and resourced adequately, such that there is an infrastructure at an organizational level in the community. So that's very important. Literally, if I look over my shoulder and head and have someone just as miserable as I am and supporting me and vice versa, that really helps to add the energy. So the infrastructure is something that we cannot neglect. And also to mention that training, supervision, and coaching, these are not synonyms in itself. It's a specific term that refers to rich processes that must be paid attention to. Jane, you are muted. So
Oh, thank you. It seems like all of you see the value of really addressing the issues of secondary trauma and vicarious trauma. And, you know, and hopefully, you know, there's so many great programs out there and resources now, you know, kind of what you've done, Fran, and you know, trauma-informed care for children in the system. There are all of these incredible programs for the child protection workers who are dealing with the secondary trauma. So hopefully, you know, you're all embracing that and that's part of your organizational culture.
Trauma-informed care for ourselves, to ourselves, right? That's what you were saying? Yes,
Very
to
much.
ourselves, yes, I understand.
I know we're getting close to time and many of you have to get back to your critical roles that you play. There was one question I really wanted to make sure that we talked about, and it was a question about incorporating the lived experiences of those who have been in care to inform and guide our practices. Like, how are you weaving that voice into your programs and into your policies and your directions going forward?
Well, Japan, just as I presented, it's now we are starting finally. And since the 2016 amendment of the child welfare law, that is where we started to recognize that there were voices that we had to listen to. So we are starting now. It's really from now.
Thank you for sharing that.
Yeah.
Patrick, do you want to share? And Gracie?
Yeah, I think in different countries, there are a children's platform for their voices, right? So in Hong Kong, we have the United Nations CRC's training for children. We have a children's forum, so that the children bring out their issues and then discuss it. Like in legislative council, that we call it children's counselors. So another venue, maybe should be the Commission on Children, who have an arm to listen to the children's voices, so that the policies and all these implementations will be incorporated. Then the voices should be incorporated. So so that's my point.
In Singapore, we did a client service journey, which is really interviewing, having focus group with clients to also hear from them how we can improve our system and what was working, what wasn't, their own experience and feelings about it, and their suggestions. I think also when we do evaluations like just now, the qualitative, you really hear from the families, was the program even effective for you? Or was it just us being intrusive? So the qualitative element with the quantitative aspect can really give us rich insights so that we fine tune it and be more child-centric. Yeah.
In Taiwan, we also follow the CRC, okay, and then we, our organization and among others, we train youth representatives that they could give their voices to the government, and also alongside us in the legislature. I mean, to urge the legislators to do the policy changes and the law, and also we on a smaller scale, on the more organizational level, we do surveys, okay, with our population, with the population that we serve. So we're now currently we're trying to use the survey for them to give feedback to us to see whether or not our services are in fact trauma informed, for them to evaluate. So we're also just starting. So I think it's still time for us all to start together. But I think there's just a lot of things we need to do, because I think that's certainly is not enough. Yeah.
Thank you for sharing that, Fran.
I'm sorry, I just answered that we're not doing anything, but it's not that we are trying to listen to children's voices, but it's still in development. Yes.
And I think that's fair, Ayaka. I think, many of us aren't good at that part, right? To safely engage children's voices in what we're doing. And so, again, I think many people are where your country is, and, I think we all can relate to that. And then the only other question that came up in multiple times was this whole issue of cultural norms. So overcoming cultural norms in regards to what is considered abuse and what is, public disclosure of abuse. And, I know that we've probably all dealt with that. And, I guess the audience would kind of like to know how you get past that and how you consistently move forward in programs that address these cultural norms.
Is it okay if I ask one question about what is the
Absolutely.
definitions of child abuse in every country? Like I presented in Japan, child abuse is from a parent, is limited to parents and not by, and if a caretaker, like at a nursery school, or teachers, that if they had some sort of an abusive attitude, that is not considered child abuse within our law. How is it in your countries? Is it different?
May I make a response using corporal punishment? Corporal punishment, right? Cultural norms, right? In Asian countries, in Chinese, there's a quite prevalence for corporal punishment. But as the society matures, the views of the society, the members changes, right? So every year we have a ban corporal punishment event. It's one of our Starship events to sort of publicize the debate of corporal punishment. So we carry out surveys on the acceptance of corporal punishment and whether we should totally ban corporal punishment, including in the home. And over the years, the views of the public has changed for the better. So I think that every society will mature you know, and there's how to define child abuse is by community standards. You know, if a public person visualize an act which is not acceptable, he or she should have a responsibility to report. So so that's my some comments on the cultural side. Yeah.
That's
Okay.
very interesting, Patrick. Thank you for sharing that.
Yes.
Also in Taiwan, we're trying to change the law in terms of parental rights to discipline. Okay, and then if we dare to take that away from parents, I think they're going to be feeling really furious and also feel that is against the culture. But I think that's why I think at this point we're dealing with in terms of how to define discipline. Okay, so it's not corporate punishment. And then so a lot of public education is needed. So like we started the No Hit Zone campaign, and then also the Orange Ribbon, or I mean all these campaign, and to really try to make it as close to the general public as possible. So use all access to reach out to different certainly the younger generation, for them to change their mindset and from the point on, I mean, being very young parents. And so I think that's a long journey. We all have to deal with it. And then I think we just have to really do it step by step. And then also, I think people will gradually change. And also we found it, like if there's a Netflix films or movie a TV series come out, and then people will start talking about it and a lot of discussion. That helped. Okay, and then I think we just have to use every opportunity to make the issues relevant to people. Yeah.
I like the thought of using public health campaigns to shift cultural norms, I think, and you're really pop culture, you know, to your example of shows and movies. That's actually really interesting.
Yes.
Great question, Ayako.
If I may add, for Singapore, there's also an added element of what is the intent and the value around the definition. So in our definitions, it's very much focused also on the future safety of the child, not so much from a retributive angle and to punish someone, but what can ensure the future safety of the child. So 5 key areas of maltreatment, physical, sexual, emotional abuse, as well as neglect and exposure to family violence. So reaching these thresholds requires intervention intentionally, so to address those risks so that the child will be safe going forward. So that's very key. As for then appealing to parents who already have entrenched beliefs, how can we go about addressing and breaking those norms and barriers? For Singapore Children's Society, we actually had a joint study with Yale and US College in 2021, a 2-part mixed method study. And the key finding that we have is, firstly, both parents and young adults find that physical discipline, corporal punishment, is not effective. Parents themselves say so, but yet they still use it. So there's a disconnect. The second is that the young adults are able to articulate long-lasting negative outcomes on themselves in various areas, whether it's their mental well-being, emotional regulation, self-worth, and so forth. And the third finding is that disconnect, right? Still, about 45% of our respondents still report using at least one type of physical discipline, and out of which 30% of that uses it frequently. Yeah, so we use this data to appeal to the parents' own reflection that, yeah, actually, I also don't believe in it. I don't find it acceptable. I don't find it effective. So what else can I do in order to shift the conversation on supporting them in using non-violent methods of discipline? So that's been our approach.
And also we tap on religious leaders to sometimes join our sessions or speak to families, because for families that makes a lot of difference, and also has the cultural religious angle sometimes, and they become really key champions in promoting nonviolence as well as preventing child abuse. Yeah.
And it's really engaging one more level of the community when you do that. I think that could be very powerful. Okay, I know that we've gone 30 minutes over, and I appreciate so much you staying with us. I appreciate our over 200 audience members who are still online. I'd like to just ask or remind people as they sign off to Zoom that there is a survey, and we really do use the information. We'll pass on all of your comments to each one of our presenters. If there are points that you would like made in there that you'd like us to share, or additional things that you need, please, as you sign off, use the survey. And to our presenters, beyond just such an incredible thank you and your dedication to what you do, your willingness to share everything so openly and honestly with us today. The sharing of the resources is invaluable. I will say to our audience members that the links to all the resources that we shared that we've been putting in chat are available on the page that you'll be sent in your follow-up emails. So just know everything is there, as well as the recording of the session will be there for you. All the presentation slides will be there for you. So we hope that everything that you need and can gain post-webinar will be on that page. And I would just ask for our panelists if there's any key takeaways you want to leave us with. Again, we are very indebted to you for what you've shared so far. But please, the floor is yours. It is like anything that you'd like to share.
Thank you. I'm very happy being able to join. Thank you for inviting me.
Thank
Well,
you.
I just wanted everyone to put on the trauma-informed lenses to also care for ourselves. We need it. We deserve it. Yeah.
Yes, I certainly agree.
For those on lunch break, start your self-care now. Enjoy yourselves. Thank you for
Bringing it
making
to your
time.
lunch hours.
A last appeal from me is not just the public and the people sector, but the private sector is so important in this work of protecting children. So thank you for those who've been coming alongside.
My sharing will be, we're looking for very good, genuine collaboration from all levels and child's best interest. Yeah, thank you. Thank you for the opportunity. Yes.
Well said by all of you. And I think you've all proved the critical role that NGOs play in this process and practitioners play. And to your point, the community as a whole. So thank you to all of you. Thank you to our audience. Have a wonderful, I think it's lunchtime for most of you, so please enjoy. And again, you'll be receiving a follow-up email with all of the information that you need. Thank you, everyone.
Thank you.
Bye.
Have a good
Thank
time.
you.
Thank you. Thanks to all the panelists too. Thank you. Thanks, Jane.
Thank you.
Bye, everyone.
Thank you. Thank you, Fujiko. Thank you.
Bye. Bye-bye. Bye-bye.
Bye-bye.
Bye.